Hi, everybody. Thank you so much for coming. Obviously, you are at Mayor and Chief at your service. This is something that the Chief and I dreamt up, I don't know, a year and a half ago, maybe?
About that, when we started planning it.
We love to work together. And there was a mayor at your service, and then there was some different combinations of things going on, and we just thought, let's do this together, because we like to work together. And so every other event one is on the town, and then one is on the police. We kind of go back and forth. We've had some historical sessions. We've had some people that know about Vienna history. They've come in and given some talks. And so tonight, the chief is actually going to be talking to you, and we have some special guests here tonight also. So, and then at the end, just so you know, when we finish, we always leave time for questions. And your questions can be anything town related. So the chief and I are here to answer anything, or just, a comment, whatever. We're here for you. Okay.
No, thank you. And the mayor's correct. Actually, the favorite part for me is at the end, where you can ask any questions, because I know sometimes, you can get things to us through email or phone calls, but there's no better way than just raising your hand, hitting us off the cuff. Why does no one stop at the stop sign on East Street or whatever? And we're here to answer it, and we're glad to do that. Today's program, I'm sure a lot of you folks have heard about mental health. It's a very big topic right now, just nationally. And there's a lot of different efforts going on across the country, to include Virginia, to include Fairfax County, to include Vienna. And talking with the mayor, we thought it would be a really unique opportunity to bring some of the folks who are spearheading those efforts for the county, bring them in, you get to hear from them firsthand. You get to ask some questions about the programs. What is Marcus Alert? What is 988? What is a SIT trained officer? You get to ask those up front and get to ask the questions, get the answers. I think it's a very unique opportunity, and I really appreciate our guests for coming and presenting it for us. Major Dan Janicki will introduce our guest. Dan's been involved. He's been involved in crisis intervention pretty much his whole life. He's been a mess, but he's been in hostage negotiations. He's been one of the founding, really energetic members of peer support for Fairfax County. So there's no better person than Dan to help kick this off and get it moving. And it's just really, we are very lucky to have someone with his background in Vienna that can connect up with the folks you're going to hear from today. So.
Thank you, Chief. Thank you, Mayor. I just want to say a couple words. Thanks for everybody. Can you hear me okay? Okay. Thanks for coming out tonight. Again, Chief and the Mayor, very important topic that we felt was worth sharing with everybody. There's been a lot of work in the state, in the region for years on mental health diversion, people in crisis, getting the police out of being the first responders on a lot of low-level mental health cases is the goal here. Legislation, and I'm sure our guests will speak a little bit more on that, but some legislation was passed a few years ago in the state that required police departments in the region or around the entire state to implement diverting calls to hotlines and trying to eliminate as much as possible police response whenever that's an option. So with that, I want to give you an idea. Tonight I'm going to introduce Christina Manning. She is with Community Services Board, which is kind of the mothership of anything regarding mental health in Fairfax County. She works closely with the state. And her boss, Darrell Washington, he's the director of Community Services Board. I've worked with both these members for many years over different assignments, probably 2 decades at least, probably. And they're a great resource to have. We have a great partnership with them. About a year and a half, I'd say, they reached out to us because we were going to be implementing this program, and we started a committee. Well, Christina Manning started a committee and put together all the local police, law enforcement agencies, including dispatchers, 911 centers, and law enforcement agencies, and how we as a region we're going to be rolling out this new legislation. So we've been working on this for quite some time. We went live July 1 of 2023. And with that, I'll kind of open it up. I don't know, Darrell, did you want to say a few words, or Christina, whoever wants to start? I think you got it.
All right. So good evening, everyone. I'm Darrell Washington. I'm the Executive Director at the Fairfax Falls Church Community Services Board. The Community Services Board is the public agency that serves and helps individuals with mental health, substance use, and developmental disabilities that live in our locality. And 8 years ago, we undertook an effort called Diversion First. And the goal of that effort really was to try to decriminalize mental health issues in our community. Prior to that, if there was some type of low-level offense that happened in the community, officers would have to transport to the Adult Detention Center. We opened up the Merrifield Crisis Response Center so that officers had an option, if it's appropriate, where individuals could be transported and then get assessed by a mental health clinician rather than going straight to jail. So we've expanded upon that program every year. Since then, every year kind of adding an additional resource or something new to it. And right now we have a very robust sort of cadre of services across the county. But I wanted to talk a little bit tonight specifically about Marcus Alert. So Marcus Alert legislation was put into law a few years ago. It happened as a result of a tragedy that happened in the Richmond area where law enforcement had a fatal interaction with someone that was in the midst of a mental health crisis. And what happened is the state came together and they say, look, we need to find a way to minimize and find a more appropriate ways for individuals that are in the midst of mental health crisis to get support and help. And essentially what Marcus Alert is, it's a set of protocols that will allow, when appropriate, 911 dispatch center and law enforcement to have a mental health clinician work with somebody in the midst of the mental health crisis. Prior to this, if someone called 911 and they said they were having some mental health issues and what have you, 99 times out of 100, really the dispatcher was sending somebody with lights on top of the vehicle. Even if it was something that could have been resolved over the phone. They get training in law enforcement. They don't go to social work school or therapy school for that, and that's appropriate for them to be dealing with those things. What we've done is we've set up a set of protocols so that the 911 call taker can listen to the issue that's going on the other side of the phone, and then when appropriate, make the decision to transfer that call to a crisis hotline. So you have a trained mental health professional on the other end of that crisis hotline that's listening to what's going on. And what we have found, we just started this in July, is that 90% of those calls, if not more, can be resolved over the phone. They don't get bounced back to 911. They don't require law enforcement to go out into the community to work with them. And these are all times where law enforcement would have been tied up with this for sometimes hours at a time, where they're now freed up to do law enforcement type of things rather than putting on their social work badge and doing social worker things, because that's what we're trained to do, and that's our specialty area. So essentially at a very high level, that's what Marcus Alert is about, is trying to make sure that the person gets the right intervention and the right help at the right time for someone that's in the midst of a mental health crisis. Now, there's going to be times where there's a significant mental health issue going on. And at those times, it's not appropriate just for a phone call transfer. Law enforcement is going to get involved. We have a mental health mobile outreach team. So typically if you turn on any of the major news things and they talk about law enforcement and a mental health clinician was involved in the crisis de-escalation, it's a CSB mental health clinician. That's the other sort of end of that on that. We go out and we deal with that every day of the week. That happens all the time within our community. That's what we're trained to do, and we like partnering with law enforcement to try to have positive outcomes in those type of situations when one of our fellow citizens is in the midst of some type of mental health crisis. So just at a high level, that's what Marcus Alert is about. It's up, it's going right now. So if someone calls 911 right now, we'll do a triage. 911 call taker will do a triage, and when appropriate, they'll transfer that over to the regional call line. Now, the other step with that, if the regional call line can't resolve the issue, but it's still something that really needs to be focused on mental health, they can then in the future dispatch a mobile mental health crisis unit to go out in the community and to then work with that individual on site rather than doing that just over the phone. That's kind of something that we're looking to put in place over the next 2 to 3 months that will be up and going before the end of this calendar year. So again, these things we start, we'll build upon it, and we'll continue to improve it as it goes along. So Hopefully it's not too informational much. I will be around if you guys have any questions about these type of things. Just a real quick snippet about the Community Services Board. Again, we provide walk-in assessment services. So if somebody has a mental health issue, they can call us, they can walk in. If you just want to find out more information about mental health, you can take a anonymous online screening, whether it's mental health or substance use, on our website. You can call us if you want to get information about community resources, and we have staff that can provide that to you. We provide therapy services, medication services when appropriate, nursing services, crisis intervention services, care coordination services. If someone is having a significant substance use issue and they need to be detoxification off of those substances, we have a residential detoxification center out in Chantilly where they can get that service as well. A lot have been made about the opioid epidemic in our community. We have trained professionals to be able to work with individuals that are having that issue. We have staff that can come out and train any of you on how to give the life-saving Narcan. If there's some type of opioid crisis happening with individuals, anybody can save a life with that. It's amazing how quickly that happens. And it's something where I can't help them if they don't have a pulse and if they're not breathing. So just a real quick plug around our training for our Narcan for that. So again, and I want to thank the partnership with the Vienna Police. They have been with us all along. It took a year and a half to get these protocols set up, and they were right there with us, asking questions, answering questions, being content experts as law enforcement entities to make sure that these protocols are going to be set up correctly, because we want to make sure that nobody gets dropped. Someone calls 911, we want to make sure that nobody gets dropped and that it's appropriate for them to be routed to this crisis call center. That happens, but we don't want anybody calling 911 getting dropped and sort of falling through the cracks with this. So thanks a lot for your time.
Thanks, Darryl. And it's what Darryl talked about is a lot of the training we've gone through. This department's now fully trained. Dan and Tom and Too Farham went out of their way to train all the dispatchers. Because that's really when a call first comes in is where it has to be handled properly. If you start routing it to an officer or dispatching it or sending it somewhere else, that's where the ball's going to get dropped. So we spent a lot of time making sure even our dispatchers here, because they can come in on 911, they can also come in on non-emergency lines. You all know a lot of our calls come in on non-emergency lines, but they could still, our dispatchers now trained to take the same information, send it out, and get people the help. I know, and Dan and I have talked about this, having done this for over 30 years, this is so needed because that model looked the same for so long. Darryl wasn't kidding. We have all been on calls where it's like, you almost like, I don't know what to do. I'm not trained to handle this situation. And the way I handle it, most likely was not back in the day the right way to get it handled. This, I think, is a lot better, systematic, getting the professionals involved, getting the professionals to where people can get help, because that's really the goal. Darryl, I have a question for you, and this is just a personal question. As I listen to everything you all do, I almost feel like we're creating a new profession. Because I know you have like some recruiting problems on getting mental health professionals in and get them out in the field. I almost feel like we created a new profession where it's a mental health in the field with law enforcement profession.
It does take the right kind of mental health counselor that wants to do that and be out there. I kind of call it my ex-gamers that work at the CSB, that really they're kind of cut from a different cloth where they enjoy being out in the community. But we have a lot of services where we're provided in the community, where we go into people's homes and we're providing the support where individuals live, because sometimes they can't come to us,
Sure.
So that we need to go to them. But yes, we're very upfront and very transparent of, hey, your job is going to be riding right alongside a law enforcement, and everybody that you see is probably going to be in the midst of a crisis. Mm-hmm. You're not going to have any quote unquote easy cases, if you will.
Right, that's exactly, as soon as I heard, that's the first thing I thought of. It's like a lot of these people probably didn't realize what they were going to school for until they get out.
They might have not figured they were going to school for that, but when they interview with us, we're very transparent about kind of what the job is all about. Yes.
And just so you know, to keep it town-based, we did have a barricade situation where we had an individual who was having crisis in his house affecting the whole community. We'd been dealt with it for a long time. And when we have those situations, these folks are on board immediately with us. Here's how we're going to work through it. hand in hand with, honestly, the SWAT team and hostage negotiations, just to bring these things to a peaceful conclusion. And I know the big one we had, I don't know, several months ago now, thanks also to Tom Taylor's work on the command of it, we brought it to a very peaceful conclusion because everybody was on board and everyone was, kind of rowing in the same direction. I hit on 988 too. That's a suicide hotline?
Yeah.
Okay. Oh.
So the National Suicide Prevention Hotline has been around for years.
Yeah.
But it was a 1-800 7-digit number.
Okay.
So people, it's hard to remember that. So July of last year, they launched a national 988 suicide prevention hotline. Something easy to remember. Somebody says like, okay, if you're experienced a crisis, you want to talk to a crisis hotline worker, you can call 988 anywhere in the country and get hooked up with one. Luckily, our local 988 provider has been around for years. We've partnered with them, Psychiatric Rehabilitation Services, Crisis Link. They're right here in the Oakton area, right around the corner. We work with them very well, and they're also the ones that run the regional crisis call center. So when the 911 gets transferred, it's going to them.
The same, okay,
Yes.
so it's the same, okay.
Yeah.
So you could direct call it
Yeah.
yourself or get transferred into it.
Only downfall that the federal government is still working through, FCC is working through, is all of us have cell phones. If you come from a different part of the country, unfortunately, the 988 call is going to get routed to the crisis call center with wherever that zip code is for your cell phone number. It's not going to get routed here. So if you got your cell phone out in California, that's the 988 call center it's going to get routed to, unfortunately. They've not figured out that, but they say they are still working on it, and their goal is to get that figured out.
Perfect, great. Could you talk a little bit about crisis intervention training that we're trying to get everybody?
Bring that up. Crisis intervention training, which is what we call the CIT team, the evolution of mental health within law enforcement response. We kind of try to get as many officers as we possibly can trained. It's 40-hour school that they have to go through, and you become a CIT officer where you have more advanced training on how to handle a crisis situation when someone who's in a mental health crisis. Chief and I made it a priority several years ago, probably 5-6 years ago, to really push hard to get a lot of our officers to get them trained in CIT. Right now, we're at about 50% of all of our officers are CIT trained. Because the goal ultimately would be on any call, any given call, you'll have at least one CIT officer, possibly 2 or 3 CIT officers that are specially trained on handling this type of events. I think the state model, and you can correct me on this if I'm wrong, what they want standard minimum across the board is 20 or 25%? Is it 20? 20%. We're at 50 right now, so we want to stay there. I mean, it's much easier for us because we're a smaller department compared to some of the larger agencies, but the chief and I have made it a priority. New officers coming out of the academy are going to go through a 40-hour school. All our supervisors, our sergeants, all our MPOs, our senior officers are CIT certified. So we're pretty confident at any given time we have several CIT officers working the street in case an event occurs. In the middle of the night, on a weekend, they've got the training to respond to that. So I don't know if you want to go into co-responder teams. It's still,
Sure.
it's kind of there's a phased approach to this, and we'll get into a little bit more probably. So co-responder teams, you may have seen or heard of them. I think Darryl alluded to it a little bit earlier, the chief did. It's where you have a mental health professional who's basically paired up with an officer riding in a car. We don't have that currently here in the town of Vienna. Fairfax County is in the process. They have, I think, 2 or 3 co-responder teams. 3 right now. They operate out of Merrifield. County is 1.4 million people, so they're getting pulled in 10 different directions. Right now, it's a staffing issue for them, but the goal in the future, you're going to see across the state much more co-responder teams being developed. It's kind of the standard model. I know Prince William County has several co-responder teams. Ideally, we want to get there. We're just not there yet. If we had a big event like a barricade or a critical event, we know we can get the county co-responder team here. But we do have CIT officers working, our dispatchers are CIT trained, and a co-responder is available if needed. And this 911 or the 988 system are all resources where we're trying to get people to the services, to the proper services that are needed. So that's where we're at right now.
Yeah, and Dan's right. And that's we made it important to get everyone CIT trained that we can. I think at one point we were actually up to 70%, but these people go and retire on us. So we're going to keep pushing it because for me, it certainly helps with people in crisis, but also the whole program is based on listening and understanding someone and understanding what they're going through and understanding their problems. And you can use that for anything. It doesn't have to be someone in crisis. It could be you just got burglarized, you just got your car stolen, and when an officer shows up, you want to make sure that officer's listening to you, understanding what you're saying, and can, repeat what you're saying, and you can make sure your message got across to them. So I just think it's a wonderful skill set to have in general. And we will keep as we bring people out of the academy. We're both big proponents. We wish the academy would just train the people in this up front, but that's not what they're doing right now. So they come to us, we get them through field training, and we send them back for the week of CIT training. So it's really working well, and you can tell the officers the officers that really engage in it. You can tell them they come back, and it wasn't some radar training or something. It was training they really enjoyed. It's very hands-on. It's very interactive. It's very practical-based training, and they really enjoy it. And you can see that when they come in.
Yeah, the training itself is pretty challenging. I went through it. I think Tom went through it. A lot of our officers, commanders went through it. They have you experience kind of what it would be to have suffering from a mental health diagnosis of some type. There's a point in the class when you're required to wear headsets and you're hearing voices and you're trying to communicate with people as you're hearing voices in your head. And they're just trying to simulate, or they put you through a lot of scenarios on what somebody who's experiencing crisis might be going through. So a lot of the officers come out much more, understanding and compassion when they go on these type of calls. Like, oh, I think this is maybe this person has this going on, and then they're willing to sit down and talk to them and spend the time with them that's needed. And it's really a good program. It's just trying to get. Right now, the state or the county and the state is having a hard time getting enough classes where they're getting filled up so quick, and we just can't get enough officers through, and that's the challenge right now.
Mm-hmm. It's an important skill to have. I mean, I see you all. You live in Vienna. The Vienna population. We have some people in Vienna who clearly exhibit these behaviors. You see them in some of the shopping centers, and we get called on them weekly. So it's definitely a tool in the toolbox we're trying to keep out there for everybody. So, yes.
Chief, what is the first of all, thanks for having us. What is the profile of somebody who would pick up the phone and call 911 about mental health? Is it a family member? Is it just somebody observing somebody? I'm just trying to understand.
I mean, these guys can pipe in, but to me, what I've seen, it's everybody. It's a family member. It's a parent. It's the person themselves. A lot of times these people themselves are feeling nowhere to turn. What do I do? Or I know we get calls also from counselors. Someone will call a counselor and they might start making statements of, I'm going to hurt myself, or we will get calls from the counselors on that. So it comes in from any variety of avenues, honestly. I think.
Sort of issues that people should be aware of when they raise concerns to law enforcement about them?
Well, and Daryl, you can correct me if
Yeah, I can speak to that. So,
Okay.
There are confidentiality laws and Ruth and things like that, but the laws are also very specific. If it's an emergency, you can share the information that is needed in order to provide appropriate care for the individual. So if it's a true crisis, you can share the information that's needed so that law enforcement, the mental health professional, anybody else has what they need in order to make the correct intervention with someone. And to your point, family members call, just general citizens that see someone that looks like they're having an issue call. They come from all different directions as far as the type of calls that come into the 911 call center.
And I think also the big secret is, not secret, but the big thing is the idea is to get them help. So even if you were to call on your neighbor and we get involved and we do whatever, it's not like we're calling you back, like, oh, hey, here's what was going on. You know what I mean? It's once the call comes in, then you start working through the system. The idea is to get them help. We don't even necessarily track back. We don't even like, hey, what was going on with so-and-so, or what was the end result of that? Our goal is to get them into the help pipeline, however they came into our system. Sure. Okay.
Obviously, this is all very responsive. I'm just wondering if you collaborate with.
Oh, sorry, Sean, we're letting you down, man. Where's one? I'll fire him, don't worry.
I'm thinking about the homeless, that don't have people calling them and don't have a home.
Yeah.
Are you collaborating and being more proactive?
Yes.
Helping them get the help they need?
It's very much the same process because you do have the homeless. So you're right, you're not getting a family member calling, but you are getting the manager of Giant Food calling. Or we are getting calls from people in parking lots who are running into these people. And when that happens, it goes to the same system. Homeless, live in $1 million mansion, doesn't matter. We're still looking for where's best way to get them the help. A homeless individual, if we feel they're at that level, they're still going to get taken to Merrifield, where they're going to meet with a counselor and see if they're going to go into the process that way, the exact same way as anyone else. In town, we do have some homeless folks. Usually it is a concerned citizen, a business owner, or just someone that saw someone out being kind of standing out on the street corner that brings our attention to them. And then the officer usually has to start making the decisions on how that's going to play out from there.
Two questions. When a call comes in, say middle of the night, goes from 911 to the mental health line, I'll call it that for lack of a better word, and the CSB gets involved, if it can't be solved over the phone and a person has to go out, is the policy that they must be accompanied by an officer?
So it depends. We really listen to kind of what's going on the other side of the line. So we have mobile crisis units, and sometimes they will go out and work with individuals with no law enforcement there. But they'll call in to sort of dispatch and sort of say, hey, I'm going out to address 1234, and we're getting ready to, go out and talk to the individual now, so at least 911 is aware of it. But if there's information on the other end that tells us this person has a history of violence or something else like that, yeah, we're going to be waiting for the officer to come, and the mobile crisis unit will be sort of kind of the ad hoc co-responder, if you will, is that we'll be on site, but we're going to wait for the officer to get there before we go knocking on the door and trying to do some type of intervention.
And my second question is, does the CSB work actively with the local AFSP, American Foundation for Suicide Prevention? Do you work together with them?
So we have staff that are trained in suicide prevention, working with individuals that are actively suicidal. We do have programs and services where they do crossover for that. I mean, that program fundraises information to bring more attention to suicide. So we do partner with them from that standpoint. We're primarily a service provider, though.
So it sounded like some of the training, the backlog is just because there are not enough classes. Is this program getting the funding it needs, or how can the community or public help?
I think it's getting the funding. And Dan can correct me if I'm wrong. It's just pure numbers, and it's a week-long class, and it's a matter of getting, because remember, we're in this with Fairfax County, Herndon, County Sheriff's Office. So there's thousands of officers that need trained in it. So the training is there. I know from Vienna's standpoint, we have a very good connection, so we can always go get a couple seats. We couldn't afford to send 20 people at one time anyway. So our goal is to network with these folks and with Fairfax County, and when they're putting on a CIT class, we get a seat or two, and we pretty historically do, don't we?
Yeah, I was going to say one of our longer-term goals is this building here is now
Good point.
certified DCJS, meaning Department of Criminal Justice Services. They're the ones that certify all our training. This building we can now use as an official training facility. So our goal is to get some of our officers as train the trainers and become instructors for CIT. So then we can hold classes here, obviously for Vienna police officers, but also some of the other local jurisdictions. Because right now you can get them in Fairfax County Police Academy or Northern Virginia Police Academy up in Ashburn. or you got to go like down to Richmond or something.
Right.
So they fill up pretty quick too.
And that's a good point. Our old building, any of you who've been in the old building, it would not certify by DCJS as a training facility. It didn't have the audiovisual aid, it didn't have the space. So I was telling Captain Taylor, first thing he did when we got in here was bring them in, inspected the space, and we're a training facility now.
When did this go live?
The Marcus Alert,
Yeah.
June the 28th
Yeah, of this year.
of this year.
Okay. Then I want to share an incident. It was July 19th. There was obviously a homeless woman behind I managed to speak to your question, to answer your question before, I manage a small store in Vienna, and it's the Freeman store, and there was a woman in the backyard who was obviously homeless and under duress. She was very stressed. You could tell she was barking like a dog, and she was screaming. And there were children playing on the town green and some other youngsters walking by. And so I thought, I think I need to call the police, because she obviously just needs maybe a little attention. I did not call 911, so I called the non-emergency, and I can do that and it would still go to
yes, that's why
CSB?
ours are trained too. Even if you call non-emergency, they will do the same
Okay.
triage of it that 911 would do.
because there were just 2 patrol cars that drove by and no contact was made. So I'm just wondering what
Yeah.
might have happened that day.
In the perfect world, I'd prefer they make contact. They may have been looking to see, is there a disturbance? Is there something going on? I'd prefer they actually make contact with that individual. And the first things the officers are going to be looking for, are you a danger to yourself or others? Those sort of triggers. I can't explain why officers didn't stop or even come see you. But that's another thing you could also do. If you call, you can always make it a point to say, I see the complaint, come talk to me, and I'll point to you where the lady is or where the issue is. Because sometimes the officers will go by and they'll miss the point of the call or what was going on.
Well, then I'm wondering why so I guess I don't understand the process then. Was someone going to transfer or take the information I gave a full description, et cetera, and give that to the CSB, and they would have taken care of it? Or do patrolmen still have to come
The
on
officer
scene?
still, I think in that case, the officer still would have came out because you're not directly, or dispatch is not directly contacting the woman. If the woman called now, then it goes into the flow. But since
Okay.
she didn't call,
No.
we have to make that connection somehow. Normally that could be an officer. And we take a lot of trips with folks down to Merrifield who just talk to people. They all don't go into in-house counseling or facilities. They talk to people and we bring them back. That happens more times than you would think.
Okay, because I was a little bit of a pest, because when I saw the cars kind of just drive by,
Yeah.
I called again and I said, hey, what's going on? And we made contact, and it was determined that she was not a threat to herself or others. I was like, no contact made, because I was watching out the window.
Yeah,
So,
well, that's it, yeah.
I don't know if it was the same lady or not, but there was someone behind Freeman store a few months ago, or a few weeks ago. We responded out several times and spoke to her. When we do have a small population of homeless people here in town. Our officers know most of them. We come in daily contact with them. In a situation like that, if she's barking and talking to herself, we will get calls on that. But most of her, if it's the case I'm thinking of that I had heard, we had been out several times and spoke to the lady. I don't know if it was that particular day they actually spoke to her, but different squads are working. The officers become familiar with the handful of current homeless people we have in town. Typically it's 4, 5, 6 of them. It varies, but most of them are mental health. They don't want any services. They're not threatening people. They're not a threat to themselves. We asked them, can we take you anywhere? Can we bring you to a shelter? Can we bring you to Merrifield? They refused to go, so we're kind of limited at certain times, in what we can do.
thank you.
Okay. I have 2 questions. One, I think you said a stat, something like 90% of the calls that come in can be resolved over the phone. I'm curious what that means, resolving something over the phone.
So that essentially means that the crisis worker is able to get the individual in a space where they feel like their mental health crisis has been resolved. They may still have a underlying mental health issue, but it's not like at a crisis thing, and it hasn't escalated where the crisis worker thinks that, hey, this person is a harm to themselves or someone else or something, where we really have to do an immediate intervention to get services and support for that individual.
Thank you for clarifying. And my second question is, the conversation has been chiefly focused on crisis, and I'm curious how autism plays into any of these conversations, training program, awareness of autism, interactions with autism, on the street, let alone an elevated situation.
Yeah, sure. I mean, Dan can expand more based on the CIT background, but I think it's still the same skills, is the calmness and the listening and the talking and not escalating a situation. And I'm not going to by any means claim to be an autism specialist, but I think those are the same skill set we should have if we are interacting with somebody with autism. I mean, does the class get into?
The class does. The CIT class does get into certain diagnoses, and one of them is children or people on a spectrum. So the officers are not obviously highly trained on that, but they're familiar with certain signs and how, what to do and what not to do, depending upon what type of person you're dealing with. That's when we kind of rely on the experts. We will call mobile crisis and see if they have a co-responder team to come or a mobile crisis unit to come and help the situation. If it's calm, we got all day. We can sit there and talk all day long. If it's getting kind of, a situation that's getting elevated and we have to act, then we will. But for the most part, the officers know at least to recognize what signs to, let's not escalate this anymore, and then get the experts there.
Sorry, I'm just going to, since you're here. And I applaud everything you're doing. I really appreciate it. My husband's federal law enforcement, so we support, the work that you're doing. And he actually had a question. I'm representing both of us. He's home with our son right now. If Vienna has ever considered, or Fairfax County has ever considered, like a special ID that can indicate somebody has a diagnosis that's like beyond a law or a driver's license. So let's say there is an encounter and you ask for an ID, they could show you an ID that's not a driver's license, but it lets someone clearly know that somebody has an autism spectrum disorder or any kind of other disorder. And maybe not even that like specific, but just something that indicates there's a special situation.
We have something similar to that right now that we've activated. It's not a bracelet or an ID, but it's a voluntary process where if a family member wants to make us aware, meaning law enforcement, 911 centers, that someone is residing in a house that has some medical condition or some mental health condition or whatever the situation is, you can let us know. So it'll be put into a certain file. What's the name of it right now? There's a SOS, I believe. It's a fairly new system. Fairfax County implemented it. We kind of partnered with them and we're using it now. We haven't pushed it out that hard yet, at least advertising it yet, but it is something that's available. I know I've seen other jurisdictions around the country doing what you're suggesting, like an ID tag of some type. It's definitely not a bad idea. I think we'd be open for something like that.
Sure.
Is there any thought about including some of this training in the normal police academy training that you get?
Sure, and they do. The police academy touches on this training. It's just when we start talking about things like CIT, that's a formal certified program that when you walk out, you have that certification. A lot of this training, I'm sure CSB and everyone else, they do teach at the academy. It's just not the focused teaching that we send people back for. And that's just a pure time thing. The academy itself, 16 weeks right now. And there's really no one trying to make that any longer. So we go back for the specialized training. But all this is touched on the academy. I wouldn't be surprised if Daryl or Christine would talk to the academy, talk to the recruits at every session to begin with.
I don't know if it's exactly a question, but I live in the neighborhood where the barricade situation happened. And there are multiple people in this neighborhood who have mental health issues, but I feel like I've seen things go down very differently depending on the person. And personally, I did watch that situation unfold. And I would say, I mean, I know it was peaceful because the guy was not injured, but it was not peaceful to me. I thought it was rather traumatic the way he was removed from his house. I felt like the police presence escalated the situation. Not to say you weren't doing a good job, but it just felt completely out of control, whereas of another neighbor who also causes issues, but is handled much more gently, almost to the point where no one will do anything. So, like, how, I don't know, how are those decisions made?
Sure.
Yeah.
And the situation where it was a barricade, we had dealt with that individual many, many, many times, to the point where we met with the town attorney and the HOA representatives and the HOA's attorney and looked at options. The day we're talking about specifically, people were being threatened, people were being assaulted. We tried to wait that out as long as humanly possible. Captain Taylor was there for hours, trying to talk to the individual, trying to get him to come out. We couldn't just leave him in the apartment and allow the disruption that was being occurred, and we hadn't resolved the situation. There was no chance we were going to drive away and that was going to resolve itself. That's when we contacted Fairfax County. Captain Taylor was on the phone with Fairfax County, and then they were telling us, have you tried this? Have you tried this? Have you tried this? Have you tried this? And then finally it got to the point where, have you tried us coming in and removing him from the apartment, which is what we got to. I'm not going to dispute. I would much rather prefer those resolve much more peacefully, much less police presence, much less force used, damage done, if we can. But that one, I can't say. We were out there hours upon hours to try to do it that way. And when I say resolved peacefully, my goal is to resolve it without anyone getting hurt, a community member or the individual were there or an officer that's involved. And that's how we did get it resolved. But I do understand what you're saying. It's that there are different, how we interact with people. A lot of it is what we're faced with when we come in. I may talk to you and you're presenting one way, or I may talk to him and he's presenting a different way, and I'm going to react differently based on how that's going down. I mean, it's, anything else, Tom? I mean, that's...
I would just say that day in particular, there was an officer there that had a very good rapport with that individual, and his attempts that day, even though the past had been very, very positive, none of it worked. And some of the threats relayed escalated everything to where it got. And there was really, given how it all broke down, there wasn't much we could do other than how it took place. We tried everything that we could.
We really did, and that's the catch. We can't, when threats to burn and items like that are being facilitated in an apartment complex, we can't, there are times we can walk away. There are certainly times we say, well, you know what? We'll walk away, deal with this tomorrow. The world's around, we'll run into you again. But then there are situations where you just can't do that, and that's one where we actually had to, we just couldn't in good conscience walk away.
Process seems to have filled a gap, right? So there's a help gap. But what concerns me as a citizen is that there doesn't seem to be any sort of recourse for dealing with people who are just kind of in our community who have mental health issues. And almost every incident where something just goes very wrong, you hear on the news or otherwise, it's somebody everyone knew had mental health issues who just snapped. So like when, Captain Taylor, when you're talking about, they didn't pose a threat, or the lady at the Freeman store didn't pose a threat to themselves or somebody else, I just don't understand how you can make that determination. And when is that determination proven false? And what can be done about that proactively? Is there any sort of, you say you're in touch with some homeless people and mental health illness folks you regularly, like what can be done? I had a recent encounter with a gentleman who was literally the scariest looking human being I've ever seen in my life. I took pictures of this guy. Came right at me. This guy was clearly deranged, drugged out, and he's just sitting on benches in the middle of the community. And I'm thinking, why is this? Like, we've got to get this guy help, but we also have to make sure he's not going to hurt anybody. So I guess my question is, like, what can be done before that? And did this gentleman in the apartment show any signs? Like, did you know about him?
Yes, absolutely.
So then he snapped.
Well, but
right?
no, he did. That's what I'm trying to explain. Not snap, just gets to a point. We do pick up on a regular basis. That's why this whole thing, I think, is all connected. The secret is to get people into the system, to get them the help they needed before they go into crisis or when they first go into crisis. Because if you wait too, because we resolve these all over town in various ways. We talk to them, buy them French fries, everyone moves on. We bring them to Merrifield, they talk to them, we bring them back. We talk to them in Merrifield gets a order, they get committed. Some of them we arrest, a very scary individual who is breaking the law, and at that level, we make an arrest. So there are various reasons. My goal, I think, why I think we're heading in the right direction with this work and the work being done is because I do think the secret is to get them in the system as early as possible and to keep them in the system. Because a lot of people, individual we're talking about, and Captain Taylor, because we did have officers who has great contact with this individual, number one problem, he was off his medication. When he's on his medication, he was fine for a year and a half. Come off the medication for 6 months, we got a problem. And those are just the dynamics. And I'd prefer we get everyone the help they need before, even if it's officers having to go get them the help before it blows up into something. No. All right. Any other topics? The mayor's here. Anyone have a problem with taxes or anything? You got your water bill recently?
Thanks a lot. A lot of good things going on in Vienna.
I don't want to pick on the mayor. I want to pick on you.
That's easy.
Good. Oh, good. No.
It's your turn. Fairfax County has recently advertised a new program, and I think it's called TAM. It's an effort to get a hold of gun violence before it happens. And they're looking to expand this program into the local jurisdictions. Are you aware of this program?
I am not up to speed on it. I have heard of it. It's funny you mention that because I think I just heard about it today. Yeah, so I'm not up to speed on it. It's something we'll look at. I mean, certainly. Knock on wood, I'm not going to say we don't have that much gun violence, but I always want a tool that's available because I also always say we're surrounded. You know, we're Vienna, but with what surrounds us does have problems and brings them into the town. So we need to be prepared for it. But I just heard of the program, today, so it's something we got to look at.
Yeah, I think what they're doing also, because the chief and I talked about it just today, we had a conversation about it. The threat assessment management team, I think the counties they've initiated real recently, and a lot of it is geared towards the red flag laws. Now, if someone possesses a gun, and you know that they have mental health issues or they're a threat or they shouldn't own a gun, there's a now legal process for us to get paperwork to take the gun from the person. It's a fairly new legal process that was just passed within the last year or so in the state. So there's been a learning curve here in all across the state, but now we're seeing more and more of these warrants actually being issued, and it becomes very difficult for law enforcement on trying to serve that paperwork, because now you have somebody who's suffering from mental health that has a firearm, and we've just been issued a warrant to go take that gun. It's a lot of them have potential to be bad scenarios. So I think Fairfax County, they're calling it threat assessment management. They're looking at guns in general, but a big portion of that work is going to be geared towards that red flag law, I think. And they are going to be reaching out to other jurisdictions. So at some point, I think we're going to look at that.
Yep. I think we've used that once already, haven't we? Red flag. We have used it in town.
Can I ask the chief a question? So sometimes I get residents and they ask me, when are they supposed to call the police? Because I get, questions like, well, we don't want to bother them. Or is this serious enough? Or, so, and let's talk about what we're talking about tonight, the mental health issues. But then also, if you could also answer after that, just kind of in general, if a car is parked outside my house and it looks funny, I tell them what I thought you had told me is call whenever you get nervous about something, because you just never know, and you guys want to know about it. But how can, like with the mental health issues, we do know we have some homeless individuals, but it could be anybody. Somebody just getting, I don't even know, I don't want to say what it might be, but what would you say would be the time when someone should just pick up the phone and either call you all or 911 now, or 988? I guess that's it.
Yeah. First one calling us, and that's the luxury I always say of living in Vienna. You have a police department that will come to anything.
Yeah.
And I would call anytime you want, anytime you feel like you mentioned the lady behind the Freeman store. Absolutely call, even if Dan is correct and we've dealt with her all day, it doesn't hurt. These guys are you're paying salaries. You're paying officer salaries to come and do this stuff, to stop and talk to someone. If it's a suspicious person, maybe he's up to something, maybe he's not. If it's a homeless individual, maybe he needs help, maybe he doesn't. I like the idea. To me, the homeless population, I at least like the idea that officers know these folks. There's no strange homeless. Officers know the name of every homeless person in town. We talk to them. Some are on vacation from D.C. They're here. They're here, and we know they're here. And I'd rather have that feeling because you called on them than the feeling of, I don't know who this person is. I don't know why they're hanging out behind the bookstore. There's only so much we can do on some cases. Giant parking lot. We get a lot of calls. Homeless people, panhandling. Giant parking lot. Well, giant parking lot, that's a private property. We can't go up there and say, get off this property, because the mayor hasn't bought Giant yet. But we do work with the management. Sometimes the management says, hey, nice enough guy, leave him alone. Dan and I, perfect example, Dan and I were in Dunkin' Donuts. We tend to go there quite a bit. But there was an individual in there, he was clearly homeless. He was not bothering a soul, but he was clearly homeless, had all the stuff, and we even asked the management, like, you okay? And they're like, he's fine. He comes in here every day. He sits there for hours, but he doesn't bother anybody. He buys 1 cup of coffee. We'll give him some extra himself. So we're like, okay, that's fine with me. But at the same time, we at least know the individual's there. We can keep track of them. If sometime Dunkin' Donuts calls and says, hey, this guy's acting weird, now we know we have a benchmark. We have a benchmark to go off of. What's different today than was different 2 days ago when we saw you in there? Right. So my stance to everybody, please call. Suspicious activity. This isn't the car stolen, mayor in chief, but we still get cars broken into. And most of those are going to get caught or at least disrupted by someone calling saying, hey, I saw a car door open at my neighbor's house, and my neighbor's never up at midnight. So, just little things like that to get us into the neighborhood, get us looking around. Again, it's the luxury of living in Vienna. I say call. You call, we have people, we'll get out. If we're busy, it might take a few extra minutes, but at the same time, if we're not busy, we're there in minutes.
To confirm, the Dunkin' Donuts type of thing, that's not that's not a 911. That's the non-emergency line.
That'd be non-emergency,
Okay.
yes. 911. Anytime you think you need immediate action, afraid of something, afraid someone's going to get hurt, afraid you're going to get hurt, afraid someone's already been hurt, like a traffic accident or something, 911. Because also you need to remember, if you call our non-emergency number, that comes here and that works just fine because they dispatch officers, but that won't get you an ambulance. That won't get you a fire truck. You will still have to go into the 911 system to get an ambulance because we do not dispatch fire or EMS from this dispatch. So if you see an accident, you want to report, you think airbag went off, that's 911. You call 911, that'll get everybody moving to it.
Ariel.
There was an incident about 2 weeks ago around Church and Glendon Street, and my one neighbor, I didn't witness it. I just hear from my neighbors. So I don't know if I have this story totally correct. My one neighbor called because of this young woman in distress.
Yes.
And was told that it took a while for 3 police cars to come. And there may have been a reason for that because she had no clothes on.
Right.
And I just feel really sad for the young lady and also for these police officers that had to deal with this situation. And also, they couldn't do anything until my other neighbor gave clothes to the police officer so she could wear. It just had to be a terrible situation for the police and for this young lady to have so much distress mentally. And what were the feelings of the police officers dealing with this
And I can
case?
tell you, I was listening to that call in my office. If anyone told you it took us a while to get there, they're exaggerating. It didn't. Officers ran out of the station to get there. Everyone was working. We got there immediately. She was on a porch. A neighbor, great neighbor, did bring some clothes for her. At the same time, our motor officer Chip, found her clothes down the road.
And she thought, everyone thought Officer Chip was wonderful.
Yeah, but that is a good example of someone in crisis because, she was in crisis. And we did. We got clothes on her, talked to her. She was on the porch of a house right there at the corner. And we took her to Merrifield, is where she ended up going. I don't know the end result after she got the help, but that's a perfect example of the outcome of it. Everyone kind of pitching in, doing something different to get the end result done. We even followed up back with the homeowner to say, hey, when you get home, you might want to erase your Ring camera.
Oh, she did. Kathy did. Yes, she had an very exciting time with that Ring video.
But that's why I will say I was listening, and I'm very satisfied with the response we had on that one. It was we heard the call, and there were people going who were on the street, but you could actually hear the doors of this building empty because they knew something was wrong.
So do police officers now have to carry clothes in their car?
We do carry a fire blanket, which we have all used at one time or another to put around someone who somehow lost their clothes.
Yeah, I just felt sorry
But
for
the
all
neighbor was great for
officers
bringing them, but then,
yes.
like I said, Chip found them right around the corner.
Yes.
Could you share some insights about the motorcycle chase on Maple Avenue heading towards Tyson's from a couple of days ago? Do you have any insights on that?
There was
No?
Was it our chase or?
Somebody. Yeah, there was just a random motorcyclist who was speeding off of
Yeah,
Maple, and then
I
there
think
was a
he
bunch
wrecked on Maple.
Oh, is that what happened?
Yeah, he wrecked on Maple.
Okay, yeah.
I think it
There
was
was like a chase of folks going after him towar's Tyson's, so.
I don't.
Yeah, that had to have been Fairfax County. We were
Okay.
not involved in it.
Okay.
Maybe he was coming from somewhere.
Yeah. But he is the one. I know we had a motorcycle accident on Maple. That's probably the end result of that. Yeah. And if it happens quick, we don't get called. The county will come in and out.
I just had a couple more comments about Marcus Alert.
Oh, please.
We might have touched over this, glossed over it a little bit. We didn't want to get down in the weeds on how we triage people, like when they initially call 911 or call dispatch. But we've been working on this work group for a year and a half, and we kind of try to categorize and determine what level they are from a level 1 through a 4. And a lot's put on the dispatcher to make that determination, or a call taker. And depending upon what category they fall into, 1 and 2s are what we would consider low-level threat to no immediate threat to themselves or others. So those are the ones we're going to try and divert to the hotline, the 988 center. If it's level 3 or 4, where the call taker or dispatcher feels an officer needs to go out now, there's danger, there's immediate threat to harm themselves or others, we're dispatching an officer and sometimes rescue ambulance with an officer. A lot more like details in the weeds on how we've come up with those categories. But I just want to let you know that that's kind of out there, at least trying to make an assessment, triage of what's the proper protocol response on the initial call. So, and that's all part of Marcus Alert.
Thanks, Dan.
Thank you. Thank you for this really informative session and for this really important work. I was wondering, appreciating that this is a new approach as you're describing, but also that social work, of course, is a well-established field and based on a lot of evidence over time. I was wondering what plans there are in place to kind of track the outcomes. I appreciate that you were talking about following procedures and following the training, which is all great. I was wondering for the follow-through, especially if it involves multiple agencies, if there is an effort to track outcomes for individuals or if you're kind of debriefing after or have plans in the future if there are any particular incidents that could be helpful to learn from, if there are efforts to debrief after those to keep improving over time.
So anytime there's a new initiative in the county, we have to track the outcome measures. That kind of goes with it, because once people pay for it, they're going to want to know, was it successful? Did it do what we thought it was going to do? So yeah, the answer is yes, we're going to track outcomes. So the CSB will track the service and clinical outcomes on the back end. So we'll disaggregate that information so it's private and confidential, but basically be able to speak to it at a high level. 911 has a CAD system, so they'll be able to track on the front end how good did we do at triaging the calls and doing those things. And then the call center, 988, also will be able to track the number of calls they came in, how many of those calls they will have to, resolve there, and then kind of pulling all of that information together and to make one big picture, to me, is kind of where the magic will happen with that. So one of the things that we've been doing with Diversion First is we have an annual report that comes out of that. So we know kind of what kind of outcomes we're seeing, how many folks are taken to Merrifield, are we having an increase in the emergency custody orders where an officer has to take somebody into custody that's in the middle of a mental health crisis? Is it a decrease? Are we keeping people out of the jail that should not be in the jail? So those type of things we've been tracking since the beginning of Diversion First. So we kind of have 8 years worth of data on that. This will just be new information and new data that we'll take underneath advisement, as we look at kind of the outcomes and seeing, is it doing what we thought we're going to do and what we wanted it to do?
And those triage levels that Deputy Chief Janicki just talked about, the level 1, 2, 3, and 4, how dispatchers and police officers are evaluating behavioral health calls, those levels are going to really help us drill down into the types of responses that we're seeing most often in the community and what resources we're devoting to those and where we need to make adjustments. And we've already set up a debrief process, so when there is a case that comes up that we think that the entire system of our crisis response can learn from, we're going to take that opportunity, and we have been.
He's here.
Are there any programs that are available for free for people that need mental health counseling? Or when they get into a program, do they have to pay for it?
All of our services here at the Community Services Board is on a sliding scale. So if the person does not have insurance, if they don't have the financial wherewithal to provide it, we can slide it all the way down to zero if they can't afford to pay anything. So I think there was some discussion here about homeless. So I have a homeless outreach team. We go out and I can't guarantee that homeless outreach team knows every homeless person in the Fairfax County area, but I would be surprised if it was someone that was here for longer than a few months that they hadn't met with and tried to work with. So the answer to your question is, if the person can't afford it, we have a sliding scale fee. But like any other healthcare entity, if the person has insurance, we're going to get that and collect that information just like if you or I were going to the doctor's office and bill for those services to be able to get reimbursement to help offset the cost of care.
Okay, thank you.
I have one thing to add, if
Please.
I could. There was a question asked about ID cards or how to let first responders know important information about you or a family member. If you Google Emergency Health Profile Fairfax County, you'll get to a website where you can enter information about medications you take, your emergency contacts, the phone number, your cell phone number that you may use when you call 911. If you enter your health information there, it's completely on a voluntary basis, then when you call 911 from that cell phone, the 911 call taker will be able to see all of that important health information. Medications you're taking, like if you're taking a blood thinner, if your family member has an autism diagnosis and you want to make sure a first responder knows about certain triggering behaviors, all of that information can be provided to 911. Google Emergency Health Profile Fairfax County and you'll get to the website where you can enter that. Alternatively, all of us on our iPhones have that little heart app. You can also enter the information there, and 911 will also be able to see it when you call.
I didn't know that. Good information. So much information tonight. I want to just thank everybody for coming. Thank you so much. I mean,
you,
this
Daryl.
is, and what great questions. You all are smart. Not that I ever doubted we had very smart residents, but really just excellent questions. And I'm learning a lot too. I didn't know a lot of this information. It's pretty new, but I think things can only continue to get better because we do have a lot of mental health issues, and we want to help the people that are suffering, and also we don't want them to hurt anyone else. So I think that's what we're all thinking about. So appreciate it, Chief. All right.
Thank you.
All right.
Take care.